Hello, and welcome everyone to Neuro-preneurs, a research to impact conversation. My name is Sonja Espenhan, and I'm the Executive Director of Campus Alberta Neuroscience. Our organization is committed to supporting and accelerating important brain and mental health research and innovation that improve brain health and patient care, but also ensures a prosperous future for Alberta. Today, we are so thrilled to host 3 of our supported Neuro-preneurs, as we lovingly call them, for a conversation about their successes and lessons learned in the journey from neuroscience research to impact. We hope you enjoyed the next hour, where these Neuro-preneurs will share key insights and advice for those wanting to innovate in the exciting neuroscience field. Before we kick things off, I would like to provide a few housekeeping items. If you encounter any issues related to the AirMeet platform, please email us at abneuro@ucalgary.ca. We'll write that in the chat box now. AirMeet recommends to use Google Chrome on your computer for best viewing. And you can also troubleshoot by refreshing the web page or switching to low definition at the bottom of your screen. There will be 15 minutes at the end for questions from the audience. Please submit your questions through the question tab on the right-hand side of the screen. And we hope to see lots of questions and engagement, and we will try to get through as many of your questions as we can. Please also note that the event will be recorded. Now, without further ado, I'm very pleased to introduce our wonderful moderator, Dr. Vivian Mushahwar. Dr. Mushawa is the director of the SMART Network and a professor in the Department of Medicine, Division of Physical Medicine and Rehabilitation at the University of Alberta. Her work focuses on developing intelligent, wearable, and implantable neuroprostheses that restore mobility and prevent secondary complications. She pioneered the development of microimplants for stimulating the spinal cord in restoring standing and walking after paralysis, as well as the development of wearable garments and smarty pants for preventing pressure injuries and deep vein thrombosis. Vivian, we are so thrilled to have you, and over to you.
Thank you very much, Svenja, for this very kind introduction. And it's really a great pleasure for me to be here today, and I'm very excited to moderate this session. We'll start with a brief introduction of our panelists, and we'll then ask each of the panelists to give a 3-minute pitch, after which we will launch into our moderated discussion. So for the moderated discussion, I'll start with some questions myself, and then we will field questions from the audience. So again, I will invite you, just as Svenja did, to enter your questions in the tab on your right. So our panelists today are Dr. Matthew Tata, Dr. Deborah Courage, and Dr. Richard Wilson. Matt is a cognitive neuroscientist at the University of Lethbridge. His research aims to understand how the brain solves the computational problems of vision and hearing. And in 2019, he launched Reverb Robotics, a company to develop auditory cognitive robotics that allow individuals to interact with service robots using speech. Dr. Deborah Courage, or Deborah, is a professor of medical genetics at the University of Calgary. Her research is focused on characterizing the genetic programs that govern hypothalamic development and how exposure to environmental chemicals changes these programs and what effect that has on the body's homeostasis. She spun out Path Therapeutics, Inc., which is a drug company discovery platform to treat disorders of the nervous system. And Richard is an international leader in cardiorespiratory control. His research focuses on autonomic nervous system, and particularly how it controls cardiorespiration and respiratory chemosensitivity. He also investigates potential treatments for cardiorespiratory related diseases such as asthma. He is the chief scientific officer at Zynetex, which focuses on creating fast-acting oral compounds to treat acute and chronic asthma in ways that go beyond the traditional airway treatments. So welcome all of you. We're just very excited to have you here today. So let's start off by hearing a little bit about your companies. And Matt, maybe we'll have you start with a 3-minute pitch.
Yeah, sure. Thank you. It's my pleasure to be here. So I guess to sort of pitch the idea of what we're working on is maybe best to go back to the mythology of the ancient Greeks. So that the ancient Greeks, in Greek mythology, there's this god named Hephaestus. And Hephaestus is the god of smiths and metalworking. And he's described as being lame. So there was something wrong with his leg. And I mean, being a god, he could have magically made things work well for him. But what he did was he fabricated autonomous tables that would kind of move around and bring things to him and take things from him. And I love that there's this idea that even in the imagination of the ancient Greeks, there were these autonomous machines that were helpful somehow. Now, thousands of years later, we have the technology to sort of actually implement this amazing mythology. But key to that is that those autonomous systems have to do what we want them to do. We have to be able to interact with them seamlessly. And it's not so straightforward to interact with something through a keyboard or a tablet. When we interact with humans, we use speech. So we expect people to understand us, and we expect to understand what they're saying back to us. And robots should be no different. There's millions and millions of robots in the world, and almost none of them can hear. So Reverb Robotics was started in 2019 to take some of the developments of artificial intelligence and natural language processing and human-robot interaction and make turnkey systems that just make it easy for manufacturers of autonomous systems to put auditory artificial intelligence onto their systems. That's what we do with Reverb Robotics.
Yeah, thank you very much, Matt. This is certainly at the cutting edge of human-machine interactions and human-robotic interactions. So thank you very much for letting us know what your company does. Deborah, we will give you 3 minutes for your pitch.
Yeah, great. So we founded Path Therapeutics several years ago now, and we are an early stage small molecule therapeutic biotech company. We have platform technology to identify new druggable targets in the CNS space. And so the rationale for our platform technology came from this idea that mitochondria are critically important for neurons, whereas most cells in our body have hundreds of mitochondria. Our neurons have millions of mitochondria. And so they're critically important for how the neurons are functioning. And so it's known that in the CNS disorders that mitochondria are dysregulated, either because mitochondria are defective and they're affecting neuronal function, or neuronal function is changed in a disease state, and that affects mitochondrial function. Either way, mitochondria can be a readout for neuronal health or disease burden. And so we worked out platform technology that enables us to measure a mitochondrial signature in a healthy and in a disease state. And for this, we use zebrafish genetic models of CNS disorders, and more recently, we've adopted the patient-derived brain organoids for this approach. And so we use the genetic models as well as a machine learning tool that we've developed that enables us to capture this mitochondrial signature, and we can then study or screen for new pathways that might be good druggable targets. So it takes away the hypotheses of disease. It opens up our brains. It gets us to move just what pathway might be improving overall neuronal health overall, and could that be a new drug target for a disease state? So using this approach, we target pediatric epilepsy as our lead target. We have other programs going on as well now. And so we've identified several new pathways, one of which is our lead program. We've done drug discovery against this pathway. We have a lead candidate now that we're moving into development phase, and it blocks seizures in a rare pediatric epilepsy form of epilepsy. And so we're now proceeding to IND enabling studies and hopefully to get this into the clinic.
Wonderful. Yeah, thank you very much for sharing that with us. Outstanding work. So we already heard about turnkey technologies that Matt was referring to, and platform technologies that you are referring to. So this really sounds like approaches that have specific applications, but also a widespread of applications. So thank you for sharing. Richard, let's go to you and have you tell us in your pitch what your company is doing.
So Zyntech stems from some work of some very bright trainees in my lab who discovered a new mechanism for asthma. So asthma's usually considered to be a lung inflammatory disease, and a lot of the medications that we use target that inflammation. But my trainees discovered there's another mechanism, a neural mechanism, which involves a sensory organ in your neck called the carotid body. And we found that inflammatory mediators from the lung activate this organ and trigger a neural reflex, which causes bronchoconstriction, which tightens your lung and generates the asthmatic attack. And they went on to find molecules involved in that mechanism, one of them being TRPV1, which is a receptor that's been investigated a lot by the drug industry for pain. So we thought we could target asthma by interacting with this receptor, by blocking this receptor. So we went on and we licensed a best-in-class second-generation drug for TRPV1, which has gone through phase 1 trials. It's been through a phase 2 trial and shown to be safe. And we now want to do a clinical trial in asthma to see if it constitutes a new pill-based therapy. But we're also broadening our scope now because this is a second-generation drug. The drug discovery has spent about $1 billion chasing a TRPV1 antagonist. The first generation drugs had side effects. This second generation drug escapes those side effects, which makes this drug usable for a lot of other indications. So we're also now pursuing secondary indications, and we hope to do a couple of clinical trials in the next year or so.
That's wonderful. Thank you very much, Richard. And cardiorespiratory issues are serious. And it's wonderful to see that you have new approaches to dealing with these health concerns, especially asthma. So thanks for sharing. And I'd like to commend all of you. Each of you had 3 minutes, but you did not use your 3 minutes, which shows that you really can communicate your message in a very effective way very quickly. And I'm saying that so that if there are trainees on the call today, so that they pay attention and be able to realize how within a minute and a half you can really communicate your message. So let's now launch into the moderated discussion. And I'd like to ask all of you, I mean, all of you are academics originally or still, and the question becomes, when was that aha moment that you felt, I think I have something here that's going to make a difference in people's lives? When did that happen for you, Matt?
So I was very lucky to get to spend a full year sabbatical leave working with a fantastic robotics group in Italy at IIT Genoa. And at the time, this was in 2013, and at the time I was sort of looking ahead and thinking, is this all I'm going to do? Is all I'm going to do to write papers for the rest of my career, and that's it? And I wanted to like create something, but I wasn't sure what that was. So I went and worked with this robotics group, and developing sort of artificial cognition algorithms. And they have a very sort of neuromorphic kind of biomimicry inspired approach to robotics. And I distinctly remember trying to work on this. I was writing a sort of simulation software stack for a guided attention, auditory attention kind of selection mechanism for this advanced humanoid robot called iCub. And it wasn't working. And I realized, like, oh, it's because iCub needs a default mode network, which is it's a default mode is something that cognitive neuroscience has sort of figured out about what the human brain does when you tell it not to do anything. And the robot didn't have that. And so as a consequence, its attention system was just bonkers, and it would just jump around and whatever. And when I implemented the default mode network in the attention stack, it worked beautifully. And I thought, I spent the last 15 years studying the computational mechanisms of the human brain. I know how to do this. All I have to do is implement everything I know about how the human brain works in this robot, which is like a lifetime worth of stuff to do. But that strategy could work. And that started me thinking like, oh, maybe I'm not just a neuroscientist, maybe I'm a roboticist.
Mm-hmm.
And then recognizing that the world of robotics and automation has been dramatically distracted, I would argue, distracted by machine vision. And almost nobody's worked on machine hearing. So recognizing that that was something I thought I might be good at, and recognizing that there's this hole in the space where nobody's working on this, made me think like, okay, maybe we should try this, like start a company and go after that little spot.
Yeah, well, that's quite inspiring. Thank you very much, Matt. And hopefully it is a message for everyone that you can combine fields. You can realize that you could do what you're good at, but there are also gaps that you could fill. So thanks for that, Matt.
Let me just mention that like you said, you can combine fields. You're all neuroscientists. You already do that. Neuroscience is an intensely multidisciplinary field, so you're already good at that. You can add something else to what you already do. You're trained to do that.
Absolutely. And we should always be encouraged to do that as much as possible. Thank you, Matt. Deborah, what was your aha moment?
I don't know if there was a true aha moment. I think there was just a series of decisions that, kept doors opened and we kept walking through them, I think is probably a better way to characterize our story anyway. So it really started, we got a Brain Canada grant several years ago now. And it was a large one. It was $3 million to develop this crazy idea of whether mitochondria can be used to measure disease states, basically. And so it gave us the flexibility to think big. It was 3 years. It was $3 million for 3 years. So $1 million a year, which is a large amount of money to throw at this problem. And so we scaled up and we hired people, really smart, talented graduate students and postdocs came in on it. A few PIs were working together on this idea, and we really, initially it wasn't clear that we could measure mitochondria in a whole living organism like we wanted to. We wanted the fully networked brain. We didn't want this in isolated cells. We wanted neurons that were firing and communicating, and we wanted the mitochondria to be responsive within this network. And so we spent a lot of time developing the technology. The grant ended, like grants tend to do, and then the question was, what do we do from here? And so, the traditional academic route is that you formulate hypothesis-driven research questions and you write grants. You go to CHR and say, now that we've got this tool, we're now going to study X. But, the tool wasn't really designed for hypothesis-driven research projects. The tool was designed to see if we could tackle this problem that pharmaceutical companies have as to where do you go next for the new drug targets. I mean, you can take, for example, depression. SSRIs were discovered, like Prozac, back in the late 80s and 90s, and basically there's been no new discovery of a mechanism for depression. And so if you don't have a new target, where do you take that drug program next? So we thought, well, instead of doing hypothesis-driven research that's funded by CHR and other agencies, let's see if we can commercialize this. And so the original idea actually was that we would use our platform technology to find targets. And then we would go to pharmaceutical companies and we would say, hey, you've got a stalled neuroscience project on X or Y. We've got these targets that we've identified, but also validated. We spent a lot of time using mice models and other models to validate them. And we thought naively that they would buy them from us. And this would be a great way that we can then go find more targets and they would just buy them as assets. And I was told that pharmaceutical companies don't believe targets are assets. And I thought, well, they just haven't seen our targets yet, that they'll change their mind. And, the short version of a very long and trying time is that they don't change their mind. And so I think that, we had these targets and we just believed that these targets had the potential to alter drug discovery across the CNS space that has largely stalled, much like, Dr. Wilson spoke to in his field of asthma. The thinking had been focused on this one narrow pathway, which was good. I'm sure the drugs worked to some extent, but it wasn't the future. And so, the idea is, how can we start to develop our own programs and develop drugs around that? So I think that instead of an aha moment, it was just more of a series of decisions that we believed in our technology. We wanted to see what it could do.
And that's wonderful. So we started off with an idea, and that idea was clearly advantageous for multiple applications, and you pursued it. We'll get back to other questions as to how do you convince others of your idea. But Richard, let's go to you. And can you describe an aha moment?
So my research has always been curiosity driven. I've worked on many different kinds of animals through curiosity and a fascination with the nervous system. When I arrived in Calgary, I had the good fortune to be mentored by somebody who themselves is an entrepreneur in the academic space. And that really opened my mind to the idea that you can do both. You can do curiosity driven science, but you can be on the lookout for things that you can take out of the lab and move forward. So curiosity drove me towards studying the respiratory system, and within that system there's this very important organ in the neck. We knew it was very important because it has very powerful effects on the cardiorespiratory system, but we didn't know its disease implications. So as I've continued my curiosity research, I've always had a mind to, okay, so how is this going to be important in disease? And we discovered that TRPV1 is involved in the carotid body's function. It's a very important part of that function. And it took us many years actually to find out potential therapeutic uses of this. So no aha moment, curiosity driven, long evolution process, but keeping a mind open to the possibility of taking inventions in the lab and moving them outside.
Yeah, I think, Richard, that is a key point for all three of you, right? That you're keeping your mind open and appreciating opportunities for taking discoveries out of the lab. So thank you very much for sharing. So you very beautifully described what convinced you to go on the path that you're going on right now. How do you convince others? Because we all know that spinning off companies means that there are other sources of funding, but in the end, you need to raise funds. In other words, you always have to convince others to put money into your company. How do you do that? How do you convince others that this is the way to go? Maybe Matt, I can start with you again.
Sure, I think that's the hardest part. And there's two kinds of people you have to convince. You have to convince funding sorts of people, so investments or federal, provincial funding agencies, and you have to convince your customers. And like one of the problems that we're having right now is sort of a product market fit problem, which every company has, and that is like the classic Henry Ford quote that if I'd asked my customers what they wanted, they would have said a faster horse. If you ask robotics companies what they need, they'll say better LiDAR. And then you start explaining to them that your robot can't hear. Like, how do you? I was talking to one manufacturer of like a warehouse logistics robot, and I said, well, how do you tell the robot to stop? And he said, well, you can either press the red button on the wall or jump in front of it and go like this. Yeah. And I said, well, why can't you just say stop? And because it can't hear. So when you frame the problem that way, and point out that like when humans can't hear, we call that deafness, and it's considered a disability. If a robot can't hear, it's just okay. Like if you frame it in that way, then people start to realize like, oh, I guess to actually have a seamlessly interactive robot, it has to be able to hear. I've even given talks in which I start the talk with a video clip of an interview, but the sound off. And immediately people scramble and like, oh, there's something wrong with the audio. No, this is the world that robots exist in. There's no sound. So how can you expect them to interact with you if they can't hear you? So you just have to like frame it that way. For funding agencies, you have to convince them that what you have has a path to being commercially successful. It doesn't have to be commercially successful at this instant, of course, but just that you have worked out a path. So, and I think that if you find the right people, they do foresee that, and they can kind of project ahead and say, okay, yeah, he's onto something here.
Yeah, thanks. So really, that product market fit is a very critical point that needs to be worked on early on, right?
And how to be obvious.
Exactly. How do you make it obvious to your customer and to your investor?
Yeah.
Now, thanks, Matt. And Deborah, how the big companies would not buy your targets. So how do you convince others that what you have is the right product?
Yeah, so I think fundraising is the hardest part of this. Like, it's great to think of ideas. It's great to execute on ideas. It's great to get data and showing that your idea has some merit. But going outside the walls of academia and getting money for it is very, very hard. I think that we're trained as academics to write grants and to think about how to position. And so we can have some success in the early commercialization process with government agencies where we're still basically writing grants, and they have slightly different terminology, but it's still in essence a format that we're very used to. But I do think there's a big gap that happens with academics as they leave the walls of academia and enter into the business world of getting money for it. And venture capital view early stage companies in different ways, and so recognizing how you're viewed by the industry that you're trying to get money from, it's a bit of a learning curve to appreciate what early stage really means, and the terms that people use have very specific meanings to them. And so appreciating that how you're labeled as a company is important. I think that it's you believe in your technology more than anybody else believes in it. And so when I get to ask this question as to, how have you been able to get this far? And, it's a very simple answer for me anyway. It's just that I believe. And because I believe, I will continue. And because nobody else believes. You don't walk into any meeting and say, hey, I've got this great idea. And they say, that's amazing. Let me open my checkbook. Like, that just doesn't happen. It doesn't exist. Like, get that out of your head, all you young budding entrepreneurs out there. I think I'm coming through a very long soul searching, soul sucking, depending on the day, experience a fundraising. I think that the end is near, and hopefully it will all be worth it. But it's been a very, very long road. And so I think that appreciating how hard it is to get people behind your idea. There is so much noise out there in the space. There's so much competition. One of the VCs that's coming in on my deal, I was talking to him. He was just at a conference last week. It was a 3-day conference. He said he had 420 invitations for meetings. And so it's just sky high right now, people looking for money and the competition of what you're up against. And so I think that you just believe. You have no other choice other than to believe and to continue.
Absolutely. If you don't believe in it, you can't make others believe in it. So believe in it is the most critical thing. But you said 2 other things as well. Appreciate that it is a challenge, and know your audience. How do you tell your story? So the investor is not another academic. So you need to know your audience and how you tell your story. So thanks for sharing that. Richard, Chief Scientific Officer, how are you trying to convince people that your pathway to commercialization is worth investing in?
Well, we definitely need a Tinder for investors and entrepreneurs to put those 2 pieces together. But there are kind of groups that do that kind of activity, and you can pitch to these groups, and really that's what fundraising is, doing lots of different pitches. I think you try a pitch for a while and you learn from it. If you're lucky, you can get feedback from the people you're pitching to, so you can refine your idea. But you have to realize that all investors are individual. They're individual organizations, different people, and they have different worldviews of what success may look like. So an example with us is, we start with asthma It's highly focused. We thought that would be a very good strategy, a highly focused strategy. But then some of the potential investors say, well, you know, we really want multiple shots on goal, meaning that you want to have multiple targets to de-risk. So some investors like the highly focused approach, some like the de-risked multiple shots on goal approach. They're both valid. They're both valid approaches, and you know, you have to pitch to investors. You don't really know what they want. So trying to add flexibility into your pitch is a really good thing. The whole pitching process is a matter of practice. It's not going to work out the first time, but really you do it hundreds of times, and that's really the fundraising job. And I think you have to evolve like everything else. Ultimately, looking for that partner who's a good match, who has the same worldview that you do. I agree with Dr. Karash. You know, you have to believe in your product. I think that's true with all of science. There's no clear path forward. You have to have a hunch, and you have to follow it through belief, and that's certainly true with fundraising.
Yeah. So be flexible, open, keep an open mind. Again, try to understand what your audience wants, so that they can invest in you. So all of you are academics, and at least have been academics before moving to industry. How do you, can you perhaps talk a little bit about managing the conflict of interest that arises between academia and entrepreneurship, but also the tension that may be there and that is there between academia and entrepreneurship, because the rewards for each are very different, and often they are conflicting. So Matt, how do you manage the tension? How do you manage the conflict of interest?
Yeah, those are two good questions. Well, for us, the conflict of interest issue isn't much of a problem, because unlike many labs, most of what we do doesn't require a tremendous amount of infrastructure. So all the software has been written on our own laptops, right? And we don't need expensive stuff in labs to be able to develop it, right? Yeah. But the tension between academia and the company nevertheless exists, and I think the root of it, the heart of it, is that there's kind of two models. One is that you're in academia and you develop something, you discover something, whatever, and you kind of hand it across the so-called valley of death to someone out there in industry who can commercialize it. And there's another model in which you discover something, you quit your job in academia, you launch a company, and you go do that instead. But doing both is really hard. Like, so being the CEO of a company and a professor and keeping on top of everything, you realize there's already so many different jobs you have to do to be a professor, and now you've just added on a whole stack of other jobs to be in business as well, and it does create this huge tension. The way that I've solved it is not the best way, but it's the only way that I could, and it's basically just let the company slide when I have to. And it's really unfortunate, because when we started this a couple years ago, we were way ahead of anybody, and now we're not so far ahead. And it's been slow going. I sometimes jokingly refer to it as like slow startup. It's like slow food. The pace is just not there, but I have no other choice. I have to, when I have to prep a lecture for tomorrow, I got to do that. When I've got to read that thesis, I got to do that. and the company has to take kind of the second seat.
Backseat. Yeah, no, it's tough. It's tough. Deborah, how have you managed that?
Yeah, I think it's hard. I get asked this question most all of my pitches. I'm CEO of the company right now, and I get asked why. Am I CEO and I'm still a professor? And most of them think that I should just get rid of this silly professor nonsense idea and just become the CEO. And I explain that I've spent a lot of time developing a research program. I don't care to just shut it down. And so they simplistically say to me, just take a year or two absence and then you can go back. And it's like, you don't just go back to a research program. Your grants have lapsed, your students have left, your flywheel is fully stopped, and you have to get it started again. And honestly, I don't know, I have it in me to get it started again. So I think that, I think it's hard, but at the same time, I think that, so our company is very technical. I have to try to explain mitochondria in an elevator pitch that and that gets people excited. And so I think that there's not a lot of CEOs right now that can lead that science kind of discussion. Not a lot of CEOs. There's not a lot of CEOs interested in an early stage company like mine who are just sitting around with nothing better to do, who would want to take it on. And so I think that I have felt firmly that I need to be the voice of this company until we get to a certain milestone, and then somebody else can take over. And I actually think we are at that milestone. And so I'm actually interviewing. I have a call at 2:00 today with the potential CEO. And so I think that as a founder and as a CEO, I think when you are critically important for the face of the company and when somebody else can step in and take over. I don't think that we can be professors and CEO for very long, but I do think there's a window where it's a valuable that the scientist. So when you're an early stage company, there's nothing to judge you on. You don't have revenue, you don't have a product, you don't have clinical trial data. All you have is the promise of your science. And so I think that scientist has to be central to any kind of the messaging. So I know Dr. Wilson has a different layout, so I think it'll be interesting to compare and contrast my experience and his experience. But for me personally, I think that I needed to drive the company for a certain period of time, and now I'm more than happy. I am more than happy to step aside. No question. Yeah.
I mean, there is a time to do that for sure. Mm-hmm. Richard, your experience is a little bit different.
I'll talk about that. If I may, Vivian, I'll talk about that first before I talk about the conflict of interest. I decided to surround myself with business folk, so I wouldn't have to do that. We have a CEO and chief financial officer. We have a whole team of people to work on websites, this kind of thing. That means I don't have to do it. So all I have to do is concentrate on the science. I think I agree with Dr. Karash, being the CEO and concentrating on the science is very difficult. It's very difficult to do those two things. So I'm glad I don't have to do that. I will tell you that the conflict of interest is the biggest break, the biggest sea anchor on innovation that we have. I'm a great believer in academia. I'm a great believer in these great institutions of discovery that we have. This is where thought happens. This is where discoveries happen, and hence why we're the driver of innovation in society. But we are hand-tied by conflict of interest. We are funded by grants. Those grants, if you look at the terms of references of those grants, basically you can't use those grants to enrich yourself. Now that means that if I own a company, I can't use any of that grant money for anything involved in that company. So I don't do that. But you have to look at motivation here. I know Dr. Karash. I'm sure it's the same with Matthew too. What are we doing this for? We're not really in this to enrich ourselves. We're in this to follow a new direction and to make a difference. And I think that's why we take this route beyond writing papers to make a difference. And to do that, we need to be untied. We need to be the cuffs have to come off, and we have to embrace that conflict. And I would appeal to kind of funding agencies to think about that. You want people that are passionate about their ideas, that want to spend the thousands of hours to take that idea out into the community to try something new. The last thing you want to do is handcuff them, fund their discovery, and then handcuff them so that you can't take that out into the community. Is a failing in my opinion. So yeah, conflict of interest, very, very serious. I'm sure none of us here infringe that conflict. I take it very seriously myself. I keep my funds separate, and I don't do overlapping projects. But it is a problem. I think our growth, our acceleration, and our success would be much faster if I was free to use my lab to continue our discovery.
Yeah, no, I agree with you, and maybe in the future there will be a change in how the funding mechanism works, and giving a little bit of allowance, right, to take your discovery out using that funding. I completely agree. I'd like to shift to one other topic, and it may be one of the last questions before we start getting questions from the audience. But one is related to patenting. So there is the thinking that, at least in academia and in various circles, that you need to patent everything. And certainly the universities tend to encourage that you need to patent everything. So that you can get that hit and really protect as much of your discoveries as possible. But maybe that's not the best view. And I wanted to ask you, when do you patent? What do you patent? And what is the strategy? Should everything be patented, or are you strategic in what you patent? Matt, maybe I'll go back to you.
Yeah, sure. So I've heard very different sorts of things about whether or when to patent. Like you said, I think universities love to try to get you to spend a ton of time working on patents because they look good. I've been told, don't even think about patenting something unless you think that patent is worth $10 million. Like, how do you even guess that? Like, in my field anyway, I don't know. So we've taken the strategy of just not patenting things. I mean, everything we develop is software algorithms anyway. Those are very hard to patent. The only good reason to submit patent or provisional patent applications that I know of is just to do a sort of freedom to operate search to make sure that you're not running afoul of someone else's patent. And keep in mind that all a patent gives you is the right to sue somebody. So if you don't want to go down that path, then don't go for a patent. I mean, it may be that the crux of your company, your value proposition, is that you figured out a special way to do something, and that is the value, and you want to be able to sell that patent. Like, when you exit your company, that's what brings value to your company. But our company isn't like that. Our company is like a hardware, software, service kind of company, and so we don't see ourselves exiting by selling patents. We see ourselves running this company for years to come. So yeah, it's not been so much of an issue for us.
Yeah, that's good to hear. Deborah, what is your stand on that? Again, companies do things differently.
Yeah, I think it's a really good question. I think there's much more strategy behind your patent portfolio planning than I think people give credit to. When you're an early nascent company, patents are expensive. You can, of course, go through the university tech transfer office, and then, if it crosses the bar of their level of interest, then they'll file the patent for you. So that helps with some of the expense of those, and sometimes you pay them back. And so it's very tricky, the financing of patents. The other factor that I don't think people put enough thought into is that when you file a patent, you have 12 months, and then it goes public. And whether it's issued or not, people can see your patent. So you're putting your knowledge out there in the public domain. So it's this fine line between you want to be first to market, first to file. So whoever files their provisional patent first is the one who gets that patent. So if there's a lot of competition, it's not who gets it issued, it's who gets it filed on that first date. And so sometimes you feel pressure to get your patent filed right away, but then the clock starts ticking and then people can kind of see what you're up to. So we've done a hybrid approach. So we have a patent issued on the platform technology. So that's our core, as Dr. Tata said, to our value proposition. And so we, the use of mitochondria as a screening tool is patented and owned by us. And that's our central differentiation or, core to the company. But we've also developed several assays that we keep as trade secrets about how you can actually make the core technology function better, higher throughput, faster readouts or whatnot. So we have about 6 different assays as part of our value proposition that we actually think is more valuable to us as know-how instead of out in the public domain, teaching other people how to make the patent that is in the public domain work better. So
Right.
that we don't file patents on. In the small molecule drug discovery, there's always a debate around, do you patent a pathway or do you wait for the composition of matter patent around the molecule? You can also get patents around formulation and various strategies. And so, at what point do you start to file patents? And if it's not your final molecule, is that patent going to start to be prior art against the patent you want to issue later?
Mhm.
And so you can be prior art against yourself if you're not conscious. So I think the answer is you have a good patent lawyer. Now, patent lawyers love to patent. So, you go to them with an idea. Like when I talk to my patent lawyer, he's always nagging on me, like, why have you filed this patent, this patent, this patent, this patent? I mean, he'd have me, 20 patents deep. But, I think as a board, we decide which one are critical that we protect, which one do we keep private as trade secrets, and which ones do we talk about, like at industry conferences and whatnot. And so I think you treat it holistically and as a strategy.
Yeah. Thanks for sharing that, because it's obviously a strategy that is different from what academia usually pushes you into, as Matt said. Richard, what are your thoughts on what you patent and when?
Yeah, so it really probably depends on what your discovery is and what your ultimate market is. But certainly any drug discovery, you're going to have to do multiple phase trials. Those trials are expensive. The phase 3 trial is incredibly expensive. And there's only a few drugs that have ever gone through phase 3 that haven't been sponsored by Big Pharma. We may not like that in academia, that Big Pharma does this, but it's incredibly expensive, incredibly risky, and there's no funding for that in academia. So if you come up with a small molecule and you want to take that into the clinic and do a phase 3 trial for public good, you must patent that molecule, because if you don't, no Big Pharma is going to touch it, and that means that all of that invention goes to waste. So it's critically important that it's patented. The question is, when do you patent it? Ideally, you want to leave the patent as long as you can. I don't think you want to rush into patenting, because the whole process takes years. It takes years to take a drug, to do the safety on it, to go through the phase 1, the phase 2, the phase 3, and all the time your patent is starting to burn. So what you really need is 2 molecules, and you patent 1 molecule and you keep the other molecule in your back pocket, and you bring that out later. And that would be the ideal scenario that you would have. The university, I think, is a great place. Again, I love what we do here in Calgary, and it's probably the same in Edmonton too. We have an office here, a patent office. You can contact them anytime. I've found them very responsive. They'll sit with you in your office. They'll go through your invention, and they'll make a call on whether they think it's valuable or not. As an inventor, yes, of course, you'd want everything patented, but it is very expensive. So I think it is good to listen to these people. But importantly, they take some of the cost out of it, the initial cost out of it, whilst you're establishing yourself. whilst you're pursuing the technology. And I think for academics, that again breaks the barrier of trying to be an entrepreneur, trying to take discoveries out of your lab, because the universities help you de-risk it. So, and this adds this fantastic environment we have for discovery.
Yeah, you're absolutely correct, Richard. And I think getting advice from multiple sources and knowing what your strategy, long-term strategy is very important. We're having a number of questions in the question answer. So how about I shift to one of those questions? One is, all of you discussed raising funds being a challenge. So Jen says there are a number of supports for entrepreneurs in the province, but there are also current gaps for the supporting the journey. Can you think of what those gaps are? In the let's just talk about the province and potentially even federally. Deborah.
Yeah, there's lots of gaps. So I think that the province, tries hard, but I think that they still aren't quite, the programs are still in development, basically. And so they have this wheel, and you should be able to enter the wheel and move your company through as you get more advanced, but they put different criteria around when you can, the focus of each step, so you can come in on one wheel and fall out at the next step. Like there's a bit of logistical thinking through, I think, at the province level, that everybody should get in the room together, and the programs are a little siloed. But I think that, also too, let's be honest, when oil's above $100 a barrel, the enthusiasm for diversification starts to wane a little bit. So, there's a little bit of switching back to business as usual. And I think that we need to keep the pressure on our local and provincial government to continue to diversify. I think the biggest gap is as you start to get momentum and the bigger dollar amounts start to become a reality. So I think you can go find a couple $100,000 to get started. I think you can relay that into a couple $1 million to get started. But when you start to need 5 million above, that's now real money. And I think that gets really tricky for academic professors to go and find that kind of purse. And so I think that how do you go from not just getting the commercialization out of the lab, but as you start to scale up and reach that, your growth phase, how do you start to communicate with VCs in the real world, like real money now? And I think there's some gaps in helping you bridge from, you got 500,000 here and now you need 5 million. How do you do that?
Yeah. That's a very important gap, and thanks for bringing that up, Deborah. Matt, I've got a question for you. This is from Artie. So Deborah and Richard are developing drugs. You're in a different kind of group of companies. So can you detail what investors like to see on the path to commercial success for from a different company like yours?
Yes, well, I think the answer is probably not. I can't detail that because we've taken a very different strategy, which is, I think, a harder one. And that is to, rather than raise investment, we've just bootstrapped. So the hard part about that is that we're as lean as it gets, and just sometimes we just have no money, and it's just me and my co-founder making things work. And it's very hard to, the biggest problem we have right now, the biggest gap is finding the money to match Alberta Innovates and NRC IRAP. Like, you have to put in 25% of a project, and it's like, we don't have that. Like, if you think what we're doing is good, just give us the part that you were going to give us, and then we'll do something awesome with it. But we don't have the cash flow to put that in. So on the plus side, I own 50% of the company, and my co-founder owns 50% of the company. We've raised zero dilutive capital. So we have complete control over what we want to do with the company at this point. definitely think about bootstrapping as an option and not raising investment. You can't do that in drug discovery, for example. It's millions of dollars. But if there's a way to bootstrap it, maybe leverage, an IRAP and some Alberta Innovates voucher programs or something like that, and come up with a few $1,000s. A huge thing for us was winning one of the Campus Alberta Neuroscience entrepreneurship seed grants. That just kickstarted everything 2 years ago. It's a way. It's a path. Depending on your company, it might be possible to do that.
Yeah, absolutely. And thanks for sharing, because bootstrapping is a strategy, and it could very well work for companies depending on what their products are. Absolutely.
Yeah.
Question, Richard, I'm going to ask you this question. This is from Renee. What is the most important skill you needed to learn to support your success?
I think ultimately networking. Networking is so important for everything you do. I only set up this company because I was networking at the time, and that networking was being done within academia, actually, and it put me in contact with my business colleagues, and they encouraged me to start this company. So networking, that's most important. If I can, Vivian, I'd like to go back to what we need.
Sure.
If that's okay. Debbie was asking that question. So, when you get invited to something, it's always nice to say something nice about the hosts. And I'd like to say that Campus Alberta Neuroscience and the seed money that they provided is absolutely fantastic. This is very low overhead for the inventors. Unfortunately, it's a very small amount of money. The scheme is fantastic. It wants to increase by an order of magnitude, but it really encourages people to take that leap, to try something new, and that's what we need to do as a province. We're very good at building hard infrastructure. Every road bridge that you see constructed around Edmonton or Lethbridge or Calgary is about $126 million last time I looked. $126 million per road bridge. The amount that's going into the intellectual infrastructure and the entrepreneurial infrastructure is peanuts in comparison. And I think we really need to boost that. And I think it's almost to the point where the government wants to think about having a Alberta Heritage Foundation too. So maybe this time they're not funding the academic positions, but they're funding entrepreneurs within academia. And one idea would be to have a sabbatical paid for by the provincial government, which also comes with a large check to support those budding industries. So I think we can be a bit more creative and really make the most of this energy that we have in the province to innovate at the moment. Yeah. I'm very excited about what's going on here.
Yeah. Richard, thanks for these comments, and they're really right on. We need to encourage a meaningful investment from the government, but I would definitely like to reiterate your words about Campus Alberta Neuroscience. These funds do make a difference. They're small indeed, but if they arrive at the critical time, they make a huge impact. So with that, I would like to close the moderated discussion session for today, and thank each and every one of you for really being with us today and taking the time to tell us about your journey and about your success so far, and what to be watching out for new Neuro-preneurs taking on the path. And a special thanks to Campus Alberta Neuroscience for putting this on and for continually supporting the translation of neuroscience discoveries to practice and social impact. So thank you everyone very much. Please do stay on, there are several unanswered questions. The session will stay open for another 30 minutes. So hopefully our audience will stay and will be able to interact with our neuropreneurs. So thank you very much, everyone, and goodbye.